I'm Ann Marshall, and I'm co-president of the League of Women Voters of Winnebago County, and we welcome you all to the League's forum entitled Poverty in Our Midst. Over a year ago, the League decided to research the scope and prevalence of poverty in all of Winnebago County. Some of the questions that we wanted to explore were: who are the poor? Where do they live, like rural, urban? What are their circumstances? What services are available to them? Are there barriers that hinder their ability to get out of poverty? So 7 League members worked together on this poverty initiative. And we not only did research, but we'd had too much research, actually, too many things, and we had to synthesize it down to what we felt would make sense. So we will be sharing with you some of the most significant findings that resulted from our research efforts. Also, we have presenters here who will focus on 3 areas of basic human needs that are adversely affected by poverty. They're Chris Kneep, who is a family living educator from the Winnebago County UW Extension. Susan Howlingen, Van Halligan, she told me don't forget the van, and I did, who is the Deputy Director of the Oshkosh Winnebago Housing Authority, and Ann Kriegel, who's manager of the Economic Support Unit of the Winnebago County Department of Human Services. So let's start out with, what is poverty? There are 3 premises of poverty that come from PACE, which is an organization, Poverty Awareness for Community Engagement. Poverty is complex. We know that, very complex. There's no simple answer or a reason for it. Poverty connects and intersects with other issues. It affects far and wide what happens in our communities. Poverty is a call for action. What can we do to help people to get out of poverty? What do we do with their condition? And a definition of poverty, and there are many definitions of poverty, but this one refers to an individual, family, or community's lack of goods and resources that are needed to support well-being and stability. That's very subjective. But usually, poverty is described in economic terms, and that will be kind of what we're doing here in a lot of this. We measure poverty in different ways as well. You know that the census that's taken every 10 years comes up with poverty thresholds. That's used for calculating all official poverty population statistics and is across the whole country and has certain meanings for it. But the ones that we'll be concentrating on a little more tonight are poverty guidelines. That's issued each year from the Department of Health and Human Services. And what those guidelines are used is to determine financial eligibility for certain federal programs. For instance, Health and Human Services develops the guidelines for kids to get into Head Start. Who's eligible to go to Head Start? Who gets home energy assistance is from Health and Human Services. The Agricultural Department determines eligibility for food share, which we used to call food stamps. They develop guidelines for the school lunch programs and who can get those. So that's primarily what we use in our communities. So the federal poverty guidelines for this year, I only have what is 100%. So people that, one person who earns $11,490 a year, is at the 100% poverty level. Just think now, take that down to a monthly basis. That's about $960 a month. Think of that. Think of that. You have to have housing, sometimes utilities, clothing, food. Even one person has needs that in all those areas. And a lot of times you'll hear the one quoted for a family of four, which is kind of the middle of the road. So a family of four is $23,550. That's just over $1,960 a month. There again, you've got four people that are having housing needs, clothing. They have car, they have gas to get to work, all those things. It would be very difficult, almost impossible to live on that. So keep those figures in mind. Now, where in our county is poverty? This next slide, this is from 2011, but it's kind of interesting. It's hard to read, but Winnebago County is 8th out of 23 counties from the top. But these are counties that all have populations over 65,000. So that's not the ones that don't have that many people. So Milwaukee, Wisconsin is the orange line. Milwaukee is, of course, the highest level of poverty in this. That was 21.6%. And then Portage, La Crosse, Rock, Kenosha, Eau Claire, Walworth, and then us. So we're about a third from the top, from the most poverty stricken, and then we go down from there. Now the next slide, in our county, this shows the year 2006, Winnebago County over here. 2006, there were 10.3% of our population was at the poverty level. 2011, it's 13.4, a 30% plus rise. Wisconsin is the other one. So they had a 19% increase through the state. And in our county, from 15,554 people in poverty to 21,213. Now remember what happened in between those years. And it's not that you would expect, but it's quite a significant increase. The next slide talks about highest poverty rates. This was when they did the census. You live in a census district. And actually the University Extension got this data for you and gave it to me, shows the census tracts and what the poverty level is in each of those. We have the map in the back which shows that, along with the percentage for each of the census tracts as to the poverty level. In Oshkosh, that first one, look at that, 69.1%, and it didn't tell me where that was. And I looked at it, it was Algoma Boulevard, and it went around, and I finally realized that's UW Oshkosh. And they take census there, and those students live in the dorms, fill out the forms. The ones living 6 in a 2-bedroom apartment are 8. So it's not surprising that that particular area, and it's not the same as poverty in some of the other areas, but I remember thinking, holy cow. But I think that kind of explains more what happens. It's not a wealthy, I mean, you've seen the houses back there, but they're mostly rentals and things like that. But then tract 5 in Oshkosh, that's the Merrill School area around there. And it's very funny drawn, so it's hard to describe, but it goes through Wisconsin, New York, East New York, down to the river and back up. I think that's Merrill School, and then some go over to Emmeline Cook and Webster Stanley. Track 1 is the one that's kind of where Washington School is. And then in Menasha, I don't know Menasha, so the track 29, which is 25%, is bounded by 5th Street, Highway 47, Fox River, and Little Lake Butamore. The sheriff's nodding that that sounds right. So I think he knows better than I do, much better than I do. And then track 25, bounded by West Prospect, South Oneida, Highway 10, and Racine. He's shaking his head right, that's right. But you can really look up. So those were the highest in our area. Next, this one, 4 out of 10 students in our schools in Winnebago County receive free and reduced lunch. The free lunch, you can be up to 130% poverty. So, and with the reduced lunch, when I think they pay 40 cents for that, it goes from 130 to 185. So people fit in there. The number of schools, over 50% of the students are on free or reduced lunch. Menasha, 7 schools, 6. I think that also is their 4-year kindergarten complex too, but 57%. Neenah, 2 schools are over 50. Amro, 0 are over 50%. Oshkosh, now remember that's a big district. 9 schools out of 22. And Winneconne, none of them are over 50%. I have the breakdown of each of the schools, and it's sobering, to say the least. And here's a dilemma that happens, and it did happen to someone I knew. The family was getting maybe the reduced lunch. The wife got a job at a service type job, and it took her right out of that. You know, sometimes just getting a job, which is like in this case, the new hotel, didn't pay very much, but put them right above. And so that happens a lot too. And then they lose that, so they aren't coming out very well for the other job. But that's a large program. When is poverty? Take a look at the median household income. This data came from the Wisconsin Council on Children and Families, and is based on $2,011. The amount that of median household income was $54,721 in 2006, $47,763 in 2011, which is a 13% decrease. In the state of Wisconsin, there was a 7% decrease. So Winnebago had a pretty hard time, or a little bump in the road there. The next slide is the unemployment rates in Winnebago County. This is not so surprising. Look at 2009 and 10. After that, we are beginning slowly to have less unemployment. And now we don't have the 2013 data, but during the months they sometimes fluctuate too. And this is the yearly end total. This is a very interesting slide. The living wage shown is the hourly rate that an individual needs to earn to support their family if the sole provider is working full-time, which is 2,080 hours a year. The state minimum wage is the $7.25. Regardless of how many people are in your family, that's the minimum wage. That's what you would get. The poverty rate is typically quoted as an annual income, gross annual income. But this chart has converted it to an hourly wage for the sake of comparison. Just look at that. A living wage with 2 adults and 1 child is $13.80. Poverty wage means that's an hour, $13.80 an hour. Poverty wage, which would be that 100% level, is $7. Minimum wage is $7.25. And 2 adults and so forth. So unless you're making $18.07, you're going to have a hard time providing for your family. It's even worse when there's 1 adult and 2 children, because it's worse. So it still is, look at $7.25, what does that do? It's lower than the 100% poverty level for people. That's scary to me. Now, who is poverty is the next section. Here are, in Winnebago County, here are the families with income at or below the poverty level. And you can see all families, and then they break it down by children. Married couple families, look at female-headed households. 28.5% in Winnebago County are at or below the 100% poverty level. If you have children under 18 years of age, it goes up to 37.3%. With children, little ones, only 53.8. That's, it follows along with the state statistics too, and it's becoming very apparent. For instance, women, I don't have that, but women earn less than men do anyway. And when they're on their own trying to manage, this is what happens. This also is children in poverty from the Wisconsin Council of Children and Families. And it shows you the percent changes in Winnebago County between those in that 100% level poverty from 2006 to 2011, 13.7% to 20.8%. Wisconsin had 14.9% children in poverty in 2006, so they were above Winnebago County, and 18.2 in 2011. So we were higher than the state at that point. 1 out of 5. 1 out of 5. So if we move on, we'll look now, we're going to change our focus a little bit. We are looking at 3 basic human needs that poverty affects. The first one we're going to talk about is food. I'll share a few general statistics about that before Chris talks. This is the food share, food stamp, whatever, recipients from 2008 through 2012. In 2008, there were 15,441 people receiving. And then in 12, this is Winnebago County, 27,533, which is over 75% increase. Now, things happened during those years. They made some changes, governmental changes, expanded who could receive food shares and so forth because of the recessions. Now they're pulling back, we think. So there were changes, but still the number of people who are dependent on that, and that was a safety net for them, increased significantly. The average number of households also increased, and the household could have anywhere from 1 to 10 people in it. So that is not as significant as the numbers, I think. Women, Infant, and Children, that's a program, a supplemental nutrition program for certain women. They can be pregnant, they can have infants, their children up to 5 years if there's some nutritional needs. That did not change so much because of that limited population that's getting that. However, the poverty level did go up. Those that come to them that are at the poverty level or below went from 57 to 63%. Now, services that are available besides that to families are food pantries. And this is food pantry data from southern Winnebago County, this area. There is a Oshkosh Hunger Task Force that includes, right now, 6 food pantries, and get together and help and talk about what's going on with their pantries. And there's the Oshkosh Area Community Pantry, Emmanuel UCC Church Pantry, Father Carr, Salvation Army, Lutheran Food Pantry, and his church World Outreach Center. They reported all their data. So look at the increase, the number of people, for instance, being served from 80,000 to almost 124,000, 40,000 more getting served in the area of food pantries than there were. Now, in 2009 is when the Oshkosh Area Community Pantry came and was created. So that's why we use that date. And then the increase, though, is from all of them. There also is, we weren't able to get data on, there's an Amro food pantry, it's very small, but we weren't able to get data from them. And Eureka Food Pantry served about 1,750 people last year. In the north end of the county, the big food pantry up there is St. Joseph's Food Pantry. And they serve the Fox Cities area, but Nina Menasha would go there. So they had, just from Winnebago County, those show the number of people who received help from St. Joseph's. And then there's the Cries of the Heart Outreach Ministries, served 500 households. Those are the main ones that we knew about there. Then there is the meal site data. And AdvoCap in Winnebago County has meal sites scattered throughout the county. And look at what the number of meals served in 2012 was over 50,000. They also deliver home delivered meals, and that was over almost 56,000. Father Carr, Salvation Army, Trinity Episcopal Church serves twice a month. Double Portion Soup Kitchen in Menasha served 17,000. Loaves and Fishes, again, a whole Fox Cities, from Winnebago County, though, served 167 people. So those are the general things about what's happening in Winnebago County and the services available. And Chris Kniep will start now talking more about some of the other interesting findings about food in our area.
Thanks, Ann. And you may see a few statistics over again, but maybe a little bit different slant on them. Because as I take a look at the information and the data that we find about food and food insecurity and poverty in Winnebago County, I try to put a face to it. And I try to think about who it really is. And looking around this room right now, we've got close to 75 people. Elliot, would you say? Have you counted them yet? About 75 people. So as I share some information about hunger and food insecurity in our county, I'll use those numbers to talk about what that actually means to the people who are actually in this room and what it would come out to be in terms of looking around this room. But up on the screen right now, I've got the definition that we use in Extension and that is used in poverty in talking about food security and food insecurity. And the idea of food security is that you have what you need and you're able to take care of yourself in terms of day-to-day life, a healthy life, and having food on the table to be able to do that. Whereas food insecure means some issues regarding having food available. And when it comes down to defining that a little bit more, some of the things that are talked about in terms of being food insecure are you don't know if you have access to food, you don't know where it is or where it's going to come from, you run out of it, you don't have that stockpile in the pantry or in the refrigerator or cupboard to lean on in those lean times. You have to cut back on the size of the meals that you have, or you skip meals altogether. Any one of those characteristics is the definition that's being given to being food insecure. In other words, just not for sure. And as you take a look at our population and what's happened with food insecurity rates over time, and again, bringing to life some of the things that Ann was talking about, if I could have the people in the first three tables stand up for me, these three tables and on the side, we got 9 people, right? So going back to 1996, this many people in this room would have been food insecure. That many people. Now, if I can add on the next 2 front tables over here, and maybe that next table, now we're getting close to what the rate is now. So looking around the room, we have gone from being 1 in 12 people insecure to 1 in 8. Thank you, you can sit down. So just kind of that ballpark figure, that's what that chart says to me. It says 11% or 12% in Wisconsin, and I have to put a face to it. I have to put a number of people to it, and that's what you represent in a group this size. And again, it's flipping in 15 years from 1 in 12 to 1 in 8 people being considered food insecure. It's not the same across the whole state of Wisconsin. And as we've taken a look at where is the greatest rate of food insecurity, it's the darker of the colors. And the lighter the color gets, the less people are food insecure based upon our congressional districts. So it's not the same across the state of Wisconsin. And a couple other things about that too. It changes, as Ann said too, it's changed with our food share population and how that has changed again over the last 15 years that's represented up here. The numbers have just continued to rise and rise at a pretty fast rate. So right now the state of Wisconsin is looking at about 17% of its population being food insecure and 13% of Winnebago County being food insecure. In other words, they don't know if they have an extra supply of food to rely on. They may be skipping meals. They may be wondering where that next meal is coming from. All those things that go back to that definition of being food insecure. One of the other terms that comes up that we hear about a lot is called a food desert. And a food desert is described in census data as an area that has both a low income level and has low access. It's a combination of those two things together. So this just happens to be a map of Oshkosh, and the area in pink is considered a food desert. Now, those two things have to go together, and what that means again is 20% of the population is below poverty. That makes it a low income census tract, 20% or below, and low access means that they have to go at least 1 mile to get to a supermarket in an urban area like Oshkosh, or in a rural area, they'd have to travel 10 miles to get to a grocery store or a full-service store. So putting those things together, 33% of a tract, or a minimum number of 500 people in those areas, a minimum of 500, have low access to food. Now, what does that really mean? Well, when I think about food deserts and I think about Oshkosh, and those of you that are from Oshkosh, take your trip right now around the community and picture where the grocery stores are and where they're not. It means that people in certain parts of our city are relying on food sources that aren't the lowest in cost and provide the greatest variety. So I took a trip to 3 different grocery stores today, or I should say 3 places where you can get food, and looked at a few items that I could pick up there that I would consider kind of the basics that would fit into a grocery cart. And you can see the difference between what one of those convenience stores would be compared to a discount grocery store to a full service for a loaf of bread. It went from being 88 cents to $2.19 for a 1-pound loaf of bread. If I were to pick up a gallon of milk, surprisingly, that's kind of a lost leader for a lot of places, but an average gallon of milk, pretty comparable, and the name brand. And it's important to remember a name brand. The big surprise for me was to look at a very small box of Cheerios, 8.9 ounces. At that convenience store, this box cost $5.29. When I went to the discount grocery store, $2.37, and a full service, a little bit more. But that's not to address the issue of when you get to a full service store or a discount store that you might be able to find some lower cost brands. The peanut butter, my husband likes it creamy, so I had to go creamy. $5, $2.68, or $3 for this size jar of Skippy peanut butter. And again, I wanted to stick with the same name brands to make sure I did an accurate comparison between them. And then looking a little bit further of what it would mean to live in a food desert where you don't have access to one of those discount or full-service grocery stores, a simple can of Campbell's chicken noodle soup from $2 to $1.25. A can of peas, $2 to 68 cents, same can, same brand. A Jack's sausage pizza from $4 down to $2.40 because they were on sale this week if I bought 5 for $12. And then finally, the last item up there is that when I went to take a look at what could I find in terms of fresh produce and fruits, none at the convenience store. Whereas I could buy a pound of bananas for 48 cents or 55 cents at a full-service store. If you take a look at all of those groceries together, and I'm not saying nutritious or high quality or all those other kinds of things, but things that people eat and things that people buy on a regular basis, if I was going to the convenience store because, it's only a couple blocks away and I have to carry all the groceries that I have, that load of groceries would cost $24.23 compared to $15 at a discount grocery store and $17 at a full-service grocery store. When you live in a food desert, you pay more for food, and you don't have the choices, and you may not have the nutritional value you're looking for as well. No fresh fruits and vegetables were available for those. We just recently compiled some information from participants at last year's Money Conference, and one of the people that had set a goal for themselves of eating healthier shared this quote with us that I just love. And she says, as she responded, why is it that healthy food costs more than cheap, let me back up. I'd understand why cheap food, quote, is bad for you and why the food that's good for you is so expensive. And it just resonated with me so much thinking about, why do we have that kind of food supply? Well, Anna shared a great deal about the Food Share program, but let me just highlight a couple other things about it that I think are really important. She shared with you those numbers and how it's changed in the last 10, 12 years, the numbers growing up significantly. And you'll notice that as we share data that sometimes the percentages are off by a point or two. Look at the trends, look at what's happening instead of specific numbers sometimes. But also the idea too that in Winnebago County, we have many individuals that are relying on food shares right now. When you take a look at our total population, it crosses all ages. 44% of children living or getting food shares right now. 11% of handicapped or disabled adults getting them. And elderly, about 8% of our population receiving food shares right now. And the amount of money that they actually get, each household, individual in a household, the average is $116 a month. So if you think about, as Ann was doing with that poverty level and breaking down how much money that is actually to cover everything, think about buying all of the food that you individually consume in a month's time with $116. That would be a challenge for many of us from what we typically do now compared to making that change. And just one little piece of information about what's happening at the federal level, because we don't know. The Farm Bill has not passed, and the Farm Bill actually has the monies in it that cover food shares or the SNAP, Supplemental Nutrition Program. But one of the things that's on the docket and has been for a number of years is that the amount of money that each individual receiving food shares is supposed to decrease starting in November. Now that's what had been projected if things had kept in place, and we're not sure right now if that's going to continue. Ann is nodding her head. The amount is actually decreasing. Food share, the free and reduced lunch, again, Ann talked a great deal about it. 17 schools in our county have a significant number of children on free and reduced lunch. A number of our schools also offer breakfast programs, but at this time we don't have any schools offering any supper programs. And in some communities, they're starting to do that. 10 of our schools in Oshkosh. And again, those numbers and percentages are 20, 30, 40, 50, depending upon the school district that you're in. And as Ann mentioned too, we have a variety of resources available in our community. And she asked me to talk a little bit more about the food pantries that we have in Winnebago County. And here's a picture of the one that she talked about, the Oshkosh Area Community Pantry, which is by far the largest provider of food. Right now, that pantry is serving over 2,000 households each month, or about 5,500 people. That's up about 10% from last year. So the number of people coming in the doors of the pantry continue to increase in about 160 additional households each month. On a monthly average, 130,000 pounds of food go out the doors of the Oshkosh Area Community Pantry. Over 1.3 million pounds of food last year. One of the neat things about the Oshkosh Area Community Pantry is that we're finding that 67% of the guests right now are taking fresh produce with them. And we've been placing an emphasis on having fresh produce available. And thanks to the generosity of many gardeners and many other individuals in our community, we're able to provide that. But again, the statistics don't tell a lot to me as much as having a few opportunities to volunteer at the pantry. And so as I think about some of the guests that visit the Oshkosh Pantry, and I think they're the same across any pantry that you would go to, you will find individuals like the young couple that came in one day when I was working the intake area, and you could just tell he didn't want to be there. And he would have done anything, and they were nervous, and they apologized for being there as they filled out those forms. But he'd been laid off. They were at the end of the money that they had to work with, and they just wanted to put food on the table. Another one of the guests that really struck home with me was an older woman, obviously on Social Security age, dressed up with pearls on and a sweater, and she was just like dressed up to come to get the food that she needed to make it work. And then the other guest that left a memory for me was the one that, the way our pantry is set up is based upon your family size. You can have so many items, so many points worth of food that you can take along with you. And somebody came up and they didn't have that many items, and I said, well, you could get a few more things if you want them. And the response was, no, that's all I need. She didn't want to take from anybody else, but really wanted to take what she needed. The food that's supplied by the Oshkosh Pantry is enough to provide about 4 to 5 days of food. Not a month, but 4 to 5 days of food. And as you watch people load up and take the food out, many of them are truly on their feet, boxing it so they can get on a bus. And we're very grateful that we have a bus stop right at the pantry that they can get back on that bus. The other day I saw a lady push it out to the bus stop in her cart and carry the cart back in. but to be able to transport it. So when I think about that too, I think about the choices that people make. And that, sometimes they take the lighter food because it's easier to haul than some of the heavier canned goods, for example. A couple other statistics about the pantry that I thought were important to mention is that we spend about $70,000 a year on milk, which means that every household can get 1 gallon. 1 gallon, not as many as they want. About $11,500 a year on eggs, 1 carton a month. And I'll never forget watching these little kids pack them into cartons because we were relying on volunteers to make that happen. And if we need to purchase bread, and that looks like something we may need to do down the road, $12,000 a year so that families can have a loaf of bread to take with them. Again, Ann shared these statistics from the Hunger Task Force, but they say so much to me in terms of numbers and the growth. And again, we've seen a surge at the Oshkosh Community Pantry this past year due to some layoffs and some changes, and don't anticipate those numbers going down. But the pantry's working together to meet the needs of that many households over the course of the year. So back to that first slide I shared, what does it mean in terms of poverty and a lack of food? Some of the downsides of food is not just being hungry, but long-term kind of effects on health, behavior, and learning for children as well as adults. So with that, I'll turn it back to you.
Thank you.
You bet.
The next basic human need that we're focusing on is shelter. Before Susan gets started, I just want to share a few more things about shelter. In Winnebago County, we have 66.4% people own their own home or condo or whatever. May have a mortgage, but that's the number in the houses. And apartments and other rentals are 33.6%. I guess what relates to poverty, you really should pay between 30 and 31% of your gross income on housing. Here, for the owners paid 35% or more of household income. 19.9% of them did, whereas renters paid 39.3% of them paid over 35%. Now, the fair market rents that just came out for Winnebago County, one bedroom fair market rate is $516 a month. 2 bedroom, $669. 3 bedroom, $891. I could afford maybe the 1 bedroom. But just think, again, on the level of somebody close or at poverty, what that means for rental. Then we look at the foreclosures, and this we know pretty well. Again, foreclosures in Winnebago County was not the highest by any means in that here. But see the changes over the years. Come 2008, 2009, and 10, we're starting to get better. And I think this year is, the real estate people say is even better. We aren't losing as many houses to foreclosure. I don't have a slide on this, but in terms of shelter, energy assistance, is a program that we have in the winter for people who are low income. Last year, 6,070 people were eligible for energy assistance. Of those 6,000 people, the median annualized household income was $16,205. The median poverty level in households, the median was 111%, so you were very close down there to the 100% mark. In the households, this was interesting, reporting no income were 120 out of that number. This is the homelessness and where people are receiving shelter. You can see the various Christine Ann Center, the Fox Valley Emergency Shelter in Appleton. The number there of 164, again, is from Winnebago County. And then Father Cars, who you're familiar with, and his numbers, and the number of nights that they stayed. So that's a significant number of people needing to have shelter because there's no place else to go. And there are programs available to work with those people in the shelters to help them on their way to get, so that they can manage to have and pay for an apartment. Advocate does a lot of that. It works with those people to move them out of that situation. And here are, the next slide is the warming shelters. Those are people who are, for one reason or another, are not able to go to one of the homeless shelters. So they were the ones that were out under the bridge at night in the winter, or just freezing out somewhere. We, in Oshkosh now, just I think it was 2 or 3 years ago, we opened the new warming shelter here. It's now open again. It's open from October to mid-April. They had 129 people come through there. Some stay for a couple of nights or more, maybe a week or two, and others stay and are there almost every night. They had to turn some away during that very cold weather because they are limited in how many people can stay there at one time. Fox Valley Warming Shelter is in Appleton. They had 65 people from Winnebago County there. Solution Center in Fond du Lac just was negligible. They didn't have many. One other interesting thing, just to cap this off, is the homeless students throughout the county. Oshkosh is the biggest district, so they had the most. Now it looks like it went way up in 2009 and 10 and then back down. But those are kids now, they may be at the shelters or they may be they just don't have a place to stay overnight that's a permanent housing. So again, that kind of follows the food and nutrition guidelines for, the free and reduced lunch. And one of we depend on a resource here in Winnebago County for some of the people that are really in need of housing, adequate housing. And Sue is here to talk. She's from the Oshkosh Winnebago Housing Authority and will talk to us about the services there, and also, I hope, some about what's happening with funding and waiting lists and that kind of thing.
Ann mentioned, I'm Sue Van Hullingen. I'm the Deputy Director of the Oshkosh and Winnebago County Housing Authority. One thing I'd like to clarify first thing, and Brad also, our Executive Director, thought it'd be a good idea. We are not a part of the city of Oshkosh. We are not a part of Winnebago County. We were set up under state statutes back in the early 70s. There was a need for housing, for low-income housing, and so the city stepped up. The city of Oshkosh and the county, Mr. Harris is up here in the front row, do appoint our board members. We make recommendations, they make recommendations, and then the county board for the Winnebago County Housing Authority Board, or the city of Oshkosh, the city administrator appoints those board members. There has to be one participating participant of our program on that board. That's a federal regulation, the HUD regulation. So there's always, whether it's the Winnebago County Board, Housing Authority Board, or the Oshkosh Housing Authority Board, there is a resident participant on that board, which I think is a great idea. That being said, because there's just been don't want you to blame the city or the county if there's something we do, that you're not happy with us. Let us know. Don't blame the city, don't blame the county. So, first of all, wanting to let you know some of our properties and the number of people that we serve. These are our main properties. As many of you know, there's quite a bit of renovation going on. Court Tower will be, once it's completed, probably end of December. We're hoping to have all the units occupied. probably end of January, all the final housekeeping issues will be taken care of. But Court Tower serves people over 50. There will be or there is, I should say, because we're occupying now, there is a preference for people 62 and over and veterans. So if a veteran is 50 and over, obviously they'll have a preference to someone who's not a veteran, who's 50. Mainview, we're also rehabbing that building. That is going to be 104. That's basically general population, but there's a preference for elderly and disabled first. So the elderly and disabled have the first preference to get in. If there's no one on the waiting list under that preference, other single people can also live there. Marion Manor, elderly and disabled population. There are 121 units there. One is a 2-bedroom, the rest are all 1-bedrooms. That was renovated in 2008, 2009. Foxview Manor in Omro, and then I'll jump up Riverside Apartments in Winnebago. They are each 30 1-bedrooms for elderly, 62 and over is the federal preference for those buildings. Cumberland Court, which is out on the west side of town, is 72 apartments for families. Those are 2- and 3-bedroom units. And then we have throughout, and I've kind of grouped Oshkosh, the Oshkosh Agency and the Winnebago County Agency together. There are 156 scattered family sites throughout Oshkosh, Neenah, Menasha. You probably drive by them every day, don't even know they're there. We have everything from row homes to 2-bedroom apartments, duplexes, up to 4- and 5-bedroom single-family homes throughout Oshkosh, Neenah, Menasha. And then we also own 4 group homes. Then we also have programs. We have the Housing Choice Voucher Program. We are contracted, or we have a contract with HUD for 413. We'll never get there. There's not enough money. Currently, we have under contract about 350 families in that program. We also have a home buyer program. Since its inception, which is 2000, 2001, we've assisted over 275 home buyers, and remember, these are all lower income people, home buyers with down payment funds and or rehab dollars. So we've spent more than $2.5 million for those fundings. We also had Neighborhood Stabilization Program. That was a program in 2009. That was a special on the stimulus funds that we had $1.2 million. We purchased 17 foreclosed homes in Oshkosh, Neenah, and Menasha. And of those, there were 8 homes that were then rehabbed and resold to low-income people. Then there was also some other homes that we were in a partnership with Habitat for Humanity. We also have, under the voucher program, and this is one of my favorite programs that we can do for lower income people, is we have a family self-sufficiency program. This is where they actually, as their wages increase, they may pay more rent, but that increase gets deposited into an account, into an escrow account. They can be in the program up to 5 years. There's, like any of our programs, there's lots of rules, lots of guidelines, things that they have to follow, but we're doing really well. We have, I think my next slide, I believe, oh, maybe not. I believe right now we have 26 people in the program, and the amounts that they're putting in are anywhere between $6 and $400 and some dollars a month that they are able to put away to eventually buy a home and to become self-sufficient. Some of the criteria I was asked, well, how do you get in? And this is a federal program. We have certain guidelines that we do have to follow. When someone comes and applies, they fill out an application. Their name gets put on the waiting list. When they get to the top of the waiting list, they get a letter from us saying, come on in, let's see if you qualify. So we do run a criminal background check. Now the top ones are mostly all of our programs. Well, I guess all of it is, but we have to look for drug-related activity. We have to look for citizenship or legal status. If they are on the Lifetime Sex Offender Registry, we cannot house them. There is also a Housing Authority national check now. HUD has come out with a program where if you have violated or you owe any other housing authority in the country money, or you were evicted and there's a sanction, you do not get into our program or any other program in the country. So it's really helping people get it, that they need to behave in the program. And so, it's really a good thing. We used to belong to what was called, I never really understood this, but it was called Happy Check. And some housing authorities participated in it and some didn't. So it was really difficult to know and to try to get backgrounds. If somebody moved here from somewhere else, it's hard sometimes to get that background knowledge. The following, it talks about excluded from the voucher program. We do run a rental history. We also run utility payment history and a credit history. Now, the reason that people in the voucher program, we don't run that, but the landlords do. And just a side note, the Housing Choice Voucher Program is, if, say, I can't do it because I'm in the program, but say Chris was a private landlord and I was a low-income tenant. I could rent from Chris if I had a voucher. She would pay me 30% of her income, and the housing authority would pay the rest of that money to the landlord. That's the Housing Choice Voucher Program. But landlords, good landlords, will run a rental history. They'll make sure they don't owe any money anywhere, and they have good credit. Now, when we look at credit reports, we try to be as liberal as we possibly can. Our goal is to house people. It's not to say, nope, 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 nope. We want to make sure we get roofs over people's heads. So there are certain things that we will, medical, we pretty much don't even look at it. If they owe another housing authority money, we may call that housing authority and say, hey, what would it take? Can they do a payment plan? Can we work something out? The other thing in the public housing side of things, we also have a program where they have to have 24 months of positive rental history. So it's not just a matter of not having any bad. They have to have positive rental history. That being said, they may have 1 year in the last couple years of positive and maybe not so good. If they go to the Rent Smart program, put on by UW Extension, then that will act as that second year and they can get in. So we're really trying hard to help them understand what you need to do to be a good tenant. Following the lease, knowing, budgeting, all of those things that help them. In one of our other programs, which is on the multifamily side of HUD, those HUD rules don't allow that. They say the only way we can deny someone is if they have a negative landlord history. So that's why the population gets a little bit different. We are able to be a little bit stricter on the public housing side than we are on the multifamily side of things. Unfortunately, right now we have over 1,200 people on our waiting list. We currently, in that voucher program that I was telling you about, we serving about 350 of the 413 vouchers. There's just not enough funding to get up to 413. Our administrative funds, which is what we need to hire someone to run that program, those funds are being cut right now. HUD is only giving us 69% of what it costs, what normally they would give us to run the program. So the Housing Authority has what's called non-federal dollars. Back in 2007-ish, 6, 7, HUD came out with what they call asset management. The bottom line, they went to housing authorities and said, you need to run your housing authority like the private sector runs their apartment buildings, the big Dominion managements and so on, and you need to have a property management company. Of course, they couldn't call it that. They call it a COCC or Central Office Cost Center. So our Central Office Cost Center has non-federal dollars that we have. John Franzen, prior to Brad Masterson, and Brad Masterson have done a very good job of putting money aside to save for the future. So we do have to use some non-federal dollars to make up that difference for administrative funds. Okay, so talking about financially what has happened. We have, over last year with the sequestration, we have lost funding. So we right now are a reduction in our maintenance staff. Any vacant positions that come up, we're not filling them. We had 2 3 people in the last year and a half who have moved on to other things. We have not filled those positions. Unfortunately, most of those are maintenance. So what's happening is, and I'll be really honest, I think some of our residents were a little spoiled. We tried to do the best we could anytime that there was a maintenance issue. Now we're telling our maintenance staff, unless it's an emergency, wait till you have 2 or 3 items before you go to that household. We right now have 1 maintenance staff who handles all 156 of those scattered sites. The other maintenance man will be back. He was injured. Hopefully he'll be back in December. We used to have 4 people handling the 156 units. Now keep in mind, these are family units. So I did a kind of a quick calculation before thinking, I didn't provide that number. And just kind of rounding, we're talking about over 1,375 children. Okay, think about what they can do to homes. I have grandchildren, I had children. I know what can happen. And, and that's not criticizing any parents or anything. That's just normal life. But we're not able to get out there. We're not able to, if it's a security issue, if a door is broken and it's a lock issue, we'll get out there. Obviously, if there's a flooding or something, we won't get out there. But say their toilet's clogged. They have 2 bathrooms. We're not going to rush out there. It's not going to happen. We don't have the manpower to do it. And then workload for our staff, our administrative staff. We have, I think, one of the best staffs there are, but I'm a little prejudiced. We had some staff reduction, and we had 2 managers step up and say, don't hire somebody, let me try to do that. So we have 1 manager who actually handles 4 properties, one of which is Cumberland, which is a tougher property. I'm not going to sugarcoat it. It is one of our tougher properties. We have another manager who we had a retirement, so he's taken on the home buyer program. He's taken on he has 156 scattered sites. So they're busy. And, I get phone calls saying, they never returned my call. Well, when did you call? Well, yesterday afternoon. Well, give them a little time. They'll get back to you. So those are some of the issues that we're running into. This is what our reduction was just for 2013. For Mainview, we lost over $34,000 in operating subsidy. Oshkosh Seminy family, 21. Court Tower, $66,000. And that's going to be a tough one with our rehab. And then Winnebago, the 86 family units in Winnebago, $33,178. I have a little note down here, this 2012 no funds for Winnebago County Housing Authority. HUD in its infinite wisdom saw that we had a nice little nest egg in Winnebago County. We have been rehabbing the units in Menasha. We have what we call the Menasha 40 family, and we've been gutting them. We've been putting front porches on them. We put steel roofs on them. We gutted them, made them beautiful. With capital fund money that we had been saving over the years, with operating subsidy we had been saving, and that was allowed. They told us, go do that. That's what we want you to do. Keep those properties up. Well, then they said, no, you have too much money, so we're not going to give you operating subsidy for 2012. So we lost $180,000 last year in Winnebago County. We weren't the only ones. There were other small agencies that happened to. But it's really frustrating when you're, planning that. So out of our savings and our little nest egg came those funds for 2012. It gets a little confusing, but the total operating subsidy loss for the 2 agencies, $154,747. That's a lot of money for us. It really is. Court Tower is not a cheap building to keep heated. As many of you may or may not know, all of our big buildings, Court Tower, Marion Manor, Mainview, the tenants don't pay any utilities, and there's cable television or satellite. So, because we know they don't have a lot to do. You're dealing with elderly, you're dealing with disabled, and then after Chris's comment, I'm going, wow, both Court Tower and Marion Manor are in the, what did you call it? The food desert, and probably Mainview too. There's not a grocery store within a mile. And I see people every single day, because our office is at Marion Manor, get on and off that bus with their bags of groceries, and I'm thinking, wow, what if I had to do that? It really makes you think how, that's just tough. And they're in wheelchairs, they're with walkers, there. I mean, we're very fortunate that there are bus stops by all of our buildings too, thank goodness. But it was an eye-opener when she said that. I was like, oh, oh. But anyways, that's our funding loss. I should keep going here. The voucher program is really, really probably our biggest challenge financially. In 2008, HUD changed how the administrative funding was based. There was a flat rate that we got, and then they turned around and said, no, we're just going to pay you for the ones that you lease. So now, because we don't have enough money to fund all 413 units on the housing assistant payment side, we don't have enough money to pay the people to run the program because we're at, I think I mentioned, 350 units, and we get $47 a month per unit. So we're probably right now, we've got the program bare bones at about $11,000 a month. And that's, you know, pay salary. We have to have an inspector. Those units have to be inspected. There's a housing quality standard. So whenever someone moves into a new unit, and annually, those units have to be inspected. So we have an inspector that goes out and does that. And then the person that runs the program does the paperwork, makes sure that those people are continue to be qualified for the program, that they're not committing any kind of fraud, letting us know when there's any rent change or income increases, any changes in household, because that's, you know, that's probably one of our bigger challenges is, well, I didn't know my boyfriend couldn't move in. Like, no, he can't. So, and, you know, it happens. And then the other part of that is our HAP payment. Now they've decided to base it on your previous year. Okay, we can't afford to put any more people in, so our numbers are going to go down. But now you're going to base next year on this year. It's just getting really, really complicated. And then, of course, this year, the congressional funding, it's later and later every year. We never know what our budget is going to be. We never know how much operating subsidy we're going to get for public housing. We don't know how much money we're going to get for the voucher program. So it's very difficult. Recently had someone in our office interviewing me. I won't name names, but there'll probably be an article coming up in the paper. And he said, I thought the school board budgets were difficult. So I kind of smiled because I do all those budgets. Then I wanted to get onto a lighter side. I know we'll have time for questions. I thought, here's our new building. Here's Court Tower with our new balconies. Not all of them. We couldn't afford to do all of them. But we've got some balconies. This was an old bathroom at Court Tower. This part here is the front entrance, or the entrance to the apartment. That's the kitchen, old kitchen. From the angle coming in the door, that was the kitchen. There's a new kitchen. Nice big opening. Washer and dryer in the unit. And this is another one of the kitchens with the balcony. Oh, sorry, Dragon Boat team, we had a blast. Our staff does it, we really do. We have a good staff that works very hard, and they really, really care about the residents. They care about helping them stay lease compliant and doing what we can to keep those roofs over their heads. And sometimes it's a challenge, so we had a good time. I was there for a little bit. I was supposed to be on the boat, but life just didn't work out for me that day. But they had a good time. That's it for my presentation. I did put up there, please feel free to go to our website if you want to learn more about the Housing Authority, OHA, which is Oshkosh Housing Authority, Winnebago County Housing Authority, ohawcha.org. Thank you.
We're now moving on to basic needs of health. I'll hurry through these because we're getting out of time, but the first one is insurance coverage that I have. The uninsured were 10% of our population, of all incomes. But below the 200% poverty level, it was 20% of the population were uninsured. Now, I think the insured does include Badger Care and things like that. So these are people that just do not have any way of paying medical bills. The next slide is Badger Care Plus, which Ann will talk more about, but this just shows you again the increase in the number of people who have, in Winnebago County, who have needed to use Badger Care from 9.3% in 2008 to 16.4%, and changes are coming in that, as you will hear about. In our communities, we're very fortunate to have some services for those that do not have medical insurance. The Living Healthy Clinic, which is on Bowen Street here in Oshkosh, and I know it's where the animal shelter is. It's out in that area of buildings. They've been around for a while, and they do serve uninsured persons, and most of those are low income. Those that they have had last year that were below that 100% level were 30% of their people were under that. But if you had no insurance, you can come there if you are above that level. St. Francis Free Clinic is out at Father Carr's. He was only able to give us that number of visits. It's a drop-in type place, whereas the Family Living Clinic is more appointments and things like that. Fox Cities Community Health Center, that's up and serves the northern end of the county, and they had 8,496 patients, or is that visits? But anyway, they serve that area of the county, and they take people with insurance or with Badger Care, and they do provide some dental services. Then there's the one other, dental services has been a terrible thing. For instance, the people that come to the warming shelter, when we first opened that up, volunteers were providing meals. They brought this beautiful fruit like apples. The people at the warming shelter can't eat apples. Their teeth are not there, or they're rotted. And I know when they first started this dental services, the children that came to them, their teeth had no care. Medicaid dentists can't afford to serve them. So this is a new thing that they're doing, really focusing on children. They have a mobile unit that comes out now to schools and gets children early to prevent some of this happening. So they, again, have increased their numbers in this past year, adults and children. And there is no fee for that service. So Ann Kriegel is going to talk to us about primarily Badger Care, because that's for the low income in our community. And so she's going to talk about that.
Hi, everyone. As Ann said, I'm Ann Kriegel with Winnebago County Human Services. I'm the Economic Support Manager. So my staff administers the Badger Care and Medicaid programs, the Food Share program, and the Child Care Assistance program. So we work with the people in poverty every day. To talk a little bit about health care, thank you. Just a very general background of what Badger Care is, what it means. It's a Medicaid program. Badger Care itself started, I think it was in 2002. And prior to that, we had, for Medicaid, Healthy Start for Children, and the parents, if they had any income at all, almost never could get Medicaid if they were not disabled. In 2002, the Badger Care program started, and what that did was open up the Medicaid a little bit to parents. They had to be parents of minor children, 18 or under, and then their income could go up to 200% of the federal poverty guideline. Or if they were pregnant or children, that could go up to 300% of the federal poverty. We still had a gap, though, in people who were not disabled between 19 and 64. If they were uninsured, there really was nothing available. In 2009, the Badger Care Core program was started, and about 2 weeks later, the wait list started because they had reached their capacity of what they determined. They went way over their capacity right away. And so since 2009, we've had this very few people on the core program, and everyone else between 19 and 64 uninsured, is if they were low income, is where we were at right then. So with the Affordable Care Act, some of that will change, and I'll talk about that a little bit, and that's what the PowerPoint is. And I talk about our eSIM, that's eCentral Income Maintenance Partnership. In 2012, with the budget, we had to form consortiums around the state, and ours is called the eCentral. We have 10 counties in it. And so that is how we now administer these programs. So we are part of a 10-county consortium, which I'll talk about a little bit later, too. So there is one category of Badger Care. It's for adults under 100%. That's what's happening now after January 1st. If you are an adult, whether you're a parent or not, if you're under 100% of the federal poverty limit, you will be eligible for Badger Care. If you're over, you will not be eligible for Badger Care any longer, and we send those people now to the healthcare exchanges, the marketplace. So it no longer matters whether or not they're parents or not. Pregnant women can still have a Badger Care. Children can still have Badger Care up to the 300% of the poverty. And slide showed the yearly figures. These are the monthly figures for the federal poverty guidelines. With the Affordable Care Act changes, the Medicare program, Medicaid programs for the elderly, blind, and disabled are not changing. So if someone has their Medicaid because they're on SSI, or because they're disabled, or because they're over age 65, that is not changing at all with the Affordable Care Act. There are some Badger Care programs being eliminated. The benchmark plan was a plan for families of a certain income. The core plan I talked about a little bit. The basic plan added on a few people to the core plan. They could pay a monthly premium and get that. That is all going away. We are also going to be looking at a new way to calculate income. Right now we look at who's attached to who. Mom, dad, kids would all be in one group. With Magi, my staff is calling it the gift of the Magi because we have to learn all new rules, but we are going to be looking at how do people file their taxes or intend to file their taxes, which maybe doesn't sound a lot different, but if you have a mom and a dad and kids in a household and mom and dad are not married, they cannot file taxes together. So we might be looking at mom and the kids 1 year, dad and the kids the next year, depending on how they file their taxes. So we have all new rules to learn and figure out and look at their households a little bit differently now. And that's just more about the Magi. Some different things we'll be looking at. And when I talk about the consortium, these are the counties in our consortium. And so we operate almost everything from a call center now. And by a call center, I mean it's my staff at their desk working a virtual call center with their computers. So the staff, if you call our call center, you could be talking to any eligibility worker in any of 10 counties, from Calumet, Green Lake, Kewaunee, Manitowoc, Marquette, who else do we have here? Outagamie, Sheboygan, Wapaka, Waushara, and then Winnebago. So you call, we all see the same thing in the computer, we all know the same rules, and you talk to anyone in any of the counties, and you just call that 800 number. With Badger Care Plus, those are the newly eligible people we are expecting. So in Winnebago County, for example, just from now until the end of January, we're looking at 1,080 people coming into Badger Care. Those would be the childless adults under 100% of the federal poverty level who have not been able to get Badger Care before, who will be newly eligible. And then we expect people to, of course, continue to sign up. Those are the people that will lose their Badger Care and go into the marketplace. And so if you look at Winnebago County, again, we're looking at 14,600. That's a significant number. And Winnebago County has hired 3 limited term employees to help people facilitate through the marketplace. And so that people are contacting them, but we, like everyone else, are having some problems with the website right now. So they're helping people call and fill out the paper applications and get their account set up and that kind of thing. There are some key dates for all of this healthcare stuff. Some have passed already. In September, current members who would be losing eligibility got some letters saying, hey, you know, watch for this. You're going to lose your eligibility. You want to do something else here. On October 1st, the marketplace opened for business. And if someone is Badger Care eligible, newly eligible, they can apply at the marketplace now, and that application will come to us to process after November 18th, because our system is not set up to run those through yet. If that same person would apply with us right now, we would have to deny it within 30 days, and they'd have to reapply. So we are encouraging people to either go to the marketplace or to wait to apply, one of the two. So on November 18th is when my staff will get all those applications that have gone to the marketplace that are Badger Care eligible, and then we'll enter them into our system. If they do apply through the marketplace and the marketplace determines they're Badger Care eligible, my staff will enter it. We will do no further verification until either a change or their next renewal, which would be in a year. So that may be one advantage if they can get through the marketplace, is that we don't do further verification on those. December 17th is when closure notices will go out to the Badger Care people who were still on. If they are a Badger Care core member now and they're under 100% of the FPL, they won't have to do anything. They will transition into the new plan. If they are a Badger Care parent, same thing, they will transition. Everyone else needs to do something or they will lose coverage. And they all have gotten letters. If you're working with anyone, they have letters explaining what they need to do. If they're not sure, they should call our call center. Our consortium, as well as across the state, we've all been gearing up for this. My staff, we added on 2 more eligibility workers to process these applications. I mentioned the limited term employees, all trying to get people through the system as quickly and efficiently as possible so that we're not the cause of delays, is what we're trying to do. And you keep hearing that there's no wrong door for how to apply for health care. If they apply with us, the application can go to the marketplace. If you apply at the marketplace, it comes back to us. Until November 18th, there's maybe a more right door because our system is not set up yet for the health care exchange yet. That is supposed to be happening by November 18th, though. So.
Yes and no. We do have a preference for people living in Winnebago County or have a bona fide job offer in Winnebago County, so they are moved to the top of the list. Primarily, Cumberland Court is about the only one that we tend to maybe get through the list and put other people in from other areas. But we are looking at, I'm going to stick my neck out a little bit here, but we are looking at, we're going to be refinancing that property. The mortgage is paid up in December. And we're also looking at doing a full rehabilitation of that building also. And we have asked HUD if there are any rules against making it a property where people have to have a job to live there. So we are looking into that. It is not in stone yet. Obviously, anyone disabled or not able to work, it's not an issue. But to encourage those that live there or have a preference for working people to live there. But yes, we do have a preference for, but it doesn't, if we get through the whole list and there's nobody on that list, we do have to move to the next people on the list. Turnover. In our bigger buildings, Marion Manor, that's pretty much occupied 100% all the time. The turnover may just be more in our bigger buildings, our elderly buildings, people having to go to assisted living or nursing homes. As many of you may or may not know, we also contract with Winnebago County for a full-time nursing position that's shared by 2 RNs that go to Marion Manor, Court Tower, Mainview, and the buildings in Amaro and Winneconne. So they're running all over the place. They can do like med checks and certain, help them with certain situations if they're getting out of the hospital, make sure things are set up at home and so on. So we do have that. We also have we have 3 social workers or social service coordinators that also help with that kind of stuff. I'm kind of evading your turnover question. Cumberland is our biggest turnover. Our scattered sites in Oshkosh, or part of the Oshkosh Public Housing, the turnover rate is pretty low on those sites. It might be a little bit higher up in the Menasha. I'm kind of looking, Justin's sitting here, he snuck in on me, our manager of all those units. It's really not that high. Cumberland is a little bit higher. We have a little bit more turnover. Of late, we've had some pretty good success stories of people moving up and out. We also have what's called a Section 3 program where we have to look at and advertise for low-income people in our programs to hire them, which is great. I'm all for it. And we did just recently, within the last year, hire someone or I guess it was more like a year and a half ago now, time flies, who replaced a retiree, and she has now been able to move up and out of Cumberland Court. So that's a good thing. So it varies per property. Our bigger buildings, pretty low on turnover. Mainview has quite a few openings right now just because we're still rehabbing that building.
Okay.
Okay, so the reasons people would lose their eligibility would be if they're over 100% of the federal poverty level estimated with the new MAGI rules. If the marketplace is not ready, Wisconsin's contingency plan is to continue Badger Care as it is right now. I was at a meeting in Madison last week. We did ask about that, and they said that is still the contingency plan. They wouldn't say anything more about it, though.
Well, the League of Women Voters wants to thank you for coming this evening to learn more about the presence of poverty in our county. This was meant to be an informational presentation to help all of us become more knowledgeable about what poverty is, where it is, when it is, and who it is. Recognize that there are many among us who do not have money to buy things like detergent to wash their family's clothes, much less enough money to have a washer or a dryer. We in this room are not immune to finding ourselves in economic crisis, none of us. A job layoff, a serious illness or injury, living on a fixed income, which many of us are, even now living on a fixed income, expenses are going up for everything that we need for making our daily needs met. So that's a problem for many of us. How can you help? Get involved in your communities, volunteer at your local food pantries, the Boys and Girls Club, Literacy Council. There are some handouts in the back of the room with many suggestions. Another thing we can make do with a little less, perhaps. Do you need that most expensive car, the newest gadget? What about those brand names that you were showing? Do we need the brand names? Even though they were cheaper at the discount store, the same brand names if you have to have them. Instead, save some for emergencies, some for your children's education. They're going to need it. And donations to agencies that are addressing the impact of poverty in our communities. Most of all, keep informed about some of the issues raised in this presentation, not just from Fox or MSNBC, but try to look at an issue from many angles, and although we all have biases, try to put those aside when taking a position. Communicate with your legislators, local, state, county, I can't leave out the county, and federal, and talk with your friends and neighbors. Poverty is in our midst. Let's not keep that fact hidden under a barrel. Let's try to do what we can to reduce the extent of the problem and its impact on each and every one of us. Thank you for coming.